Hello, my dear ones. I hope this finds you well and warm. I've got a podcast coming up here at 3 from Australia, so I just have a short period of time here. I thought I would try to get a couple of questions in for you, and you won't have to sit through a long video. Sorry about that. This is one that came in through probably my son's clinic on liposomal, vitamin C, lecithin, and glutathione, MSM added to it in addition to 100%. This inquiry is about this person has chronic lymphatic leukemia. Is that what that is? Because they said the situation is a recent tumor mutated cells that has appeared on the front and area under rib cage. And that this herbalist recommended this liposomal. I do not in any way, shape, or form recommend that. And I think if you look at the last video on vitamin B12, you'll see my feelings on all these type of supplements like that. Because I want you to realize you have an agglomerated area. And we were just having that conversation here about T cells, NK cells. So my immune formulas enhance NK cells, natural killer cells, T's and B's. That's all fine and dandy. But the reality is you have agglomeration. You have stagnation. And vitamin C, ascorbic acid, glutathione, all these do not open up kidney function, does not promote lymph drainage, any of this stuff like that. It's treatment-based thinking. And for an herbalist to fall into that just shows you that this particular herbalist doesn't know what herbology is for. They buy in the concept of diseases and that sort of thing. And that's what you want to be careful about. Because when you see chronic, any type of lymphatic problem, name their world of cancers, you know you have agglomeration. You know your kidneys are not filtering. On top of that, you might not be able to sweat as well. And that means your total and eliminative organs are basically shut down. And everything is developing in the body, so you're forming swellings and tumors and things like this. Lipidemic type of issues. Leukemia, of course, involves the spleen, bone marrow. No different. No different. This is what you got agglomerated, and no vitamin C formula is going to open that up. But you hear a lot of that crap through the years, through even these herbal magazines, Herbal Quarterly, and all these articles on how to enhance the immune system during the winter times and things like that. It just shows that we're the top understanders of the lymphatic system, that they just don't understand, even the natural health people understand what your immune system is and how it works. And if you take that immune word out and you put sewer system, you'll understand it better. You've got lymph nodes, which are what? Septic tanks. And when you understand that this is the body's sewer system, you can call it the immune system because this is where most of the lymphocytes or immune cells are. Okay, but that's all in the removal of either cells or acids from metabolitic or kinetic activities. You got two things to think about. As acids damage cells, these cells have to be replaced, and so you have to have a way to get them to the lymph nodes. If you don't have a way to get them to the lymph nodes, and we talked about this, monocytes can become macrophages in tissues, and that's a little aggressive stance right there. It's just still the body trying to protect itself from acid damage and the continuing breaking down of its tissues. That's what the inflammatory response is. So once you understand the simplicity of that, then this idea of treating and taking things, it's just, the next door to this is pharmaceuticals. You got this symptom, we take this product. And this is going to help NK cells. And this is going to have that. Our own immune formulas enhance NKs and T's and B's. Okay, so think of a highway where you have a wreck down the way, and this is lined up. Cars are lined up for miles, and you want to bring more cars onto the highway. Nobody's going anywhere. And that's basically what you find here, is that when you understand that tumors and cells that are breaking down, whatever level, atypical or all the way to these highly degraded cells, what's doing it? Chemistry, right? And there's only one side of chemistry that does that, and that's the acid side of chemistry. And there's only one system that deals with the acid side of chemistry, and that's the lymphatic system. So you can argue that you can use castor oil or lipid-type packs to help the inflammatory process, but at the same time, I've always gone, yeah, but we have agglomulation. The true answer to how you overcome that is hydration, which is detoxification. And that opens up the highway. So now the tumors can drain, everything can drain unless the medical doctors mess with them too much. And now you've got some serious problems. But everything has pipes to it, and so does the lymphatic system. And when these pipes are backed up, the septic tank's backs up to the cells. That's simple. Just like any other sewer system that gets backed up some way or another. And this particularly, you go into the kidneys mainly, but if your thyroid is low and you can't sweat, that means your skin is not eliminating well either. And your skin is an eliminative organ, the biggest one you have actually. So kidney filtration is always the answer. Getting the kidneys to filter, getting the kidneys back online at elimination of metabolitic or kinetic waste in the human body. You can take this crap kind of stuff till cows come home. And it's a false promise. Because when you understand the truth of all this, then you start to go, well, yeah, that makes sense. You can't treat these things. You know, you just fall deeper into the rabbit hole, even with natural products, because you have agglomulation. If you had a product that opened up the lymphatic system and made the kidneys filter like that, I'd say suck it down. Let me see if I can get a couple in here, because I only have about 15, 20 minutes here. And this is from, is that ILSE? Elsie? This is a male, so I'm probably pronouncing that wrong, so I apologize there. 63 years young, 5'9", 180 pounds. Stage 4 prostate cancer. All right? My nephew. Well, it doesn't concern him, concerns his nephew, which has got to be younger than he is. Ouch. Dear Dr. Morse, I would like your help, please. I want to know if I guided my nephew correctly. His mom was a nurse, ouch, who embedded his thinking deeply into allopathic medicine. Oh, yeah. And you know the sad thing about that is? Stupid. That means that nurse was unaware of and living a life of unawareness. Because if you spend any time as a nurse on an oncology ward, it becomes very obvious there's no curative value. Down at St. Joe's Hospital, they carried my cards on oncology and used to hand them out when no one was looking. I mean, the sad thing is you get these nurses, and I've had so many nurses kill their family members by being stupid. Allopathic medicine has no curative value to it, and to keep trying to promote someone to use it when there's no curative value, hoping that maybe you'll be one of the lucky ones out of millions, come on. So to change his thinking is a slow process. Yeah. I've got this video coming out, guys. I'm going to be shooting it next week. And this is the kind of video that you would hand him or have him view this, because I'm going to get into everything science. And there's no argument. There's not a medical doctor one out there that can argue this. And even stand on any viable ground to argue. Because we have all of it together, including the clinicals. It's one thing to postulate something. It's another thing to actually have the clinicals and actually have the proof. And we have been, all of you guys have been helping to prove this as well. So it's like you guys don't have a leg to stand on. Science is science. Duality is duality. Acid and base are acid and base. And the body is simply what it is, a bunch of cells and two major fluids. You can't go outside of that. And then when you're dealing with some type of like cancer, prostate or something, it just says that your sewer system is backed up in those tissues and is damaging the cells. And that's what acids do. They're corrosive. Study your chemistry. It's almost first up in almost all chemistry, but even chemistry for idiots. And so you have to understand what the lymphatic system is and that the prostate is full of these lymphatic vessels. And when those vessels are backed up, what do you think is going to happen to the cells that they feed or clean? Yeah, exactly. And that's all it is. And so you can't give someone chemo or something like that or radiation and think they're going to come out of this. Then it's going to, that somehow some magic, an acid that's at least twice as hot. Well, we do by logarithms, so we would be saying 100 times hotter than the acid that actually caused cell damage, because you're looking at about 3 pH is about where you're going to get a pH that's going to cause a cell to become atypical and degrade it down to what a medical or a pathologist would refer to it as a cancer cell. And chemotherapy is 1.5 to 2. Well, 2 is 10 times hotter than 3, and 1.5 then is going to be 15 times hotter. Imagine an acid 15 times hotter than the 3 that damages it. And Coca-Cola is right there at 2.5 to 3. And it chews up tissue. And if she's a nurse, then ask her what chemo looks like spilled on someone's hand. And ask her why they moved from putting it in the brachial artery and put it into the aorta. Why did they do that? And then ask her how many people die from aortic aneurysms. You know, and ask her to show you the cure ratio of chemotherapy. Joke, joke, joke. And the American Cancer Society would never have those stats on their website for years. Risky put it on his, but the American Cancer Society would never put it on their site. Because, like I said, out of 100 people entering chemotherapy, used to be only 6 would walk out alive. And that's that. And then after 5 years, half of those were gone. Now they're pumping steroids and steroids out right after that. It's like, really? How stupid. You know, it's just a extreme lack of understanding of the body's sewer system and the acid side of chemistry and what it does to tissues, what it does to the body. And it's so easy to understand. You don't need to go to med school. That's why our people that go to our classes are already curing people all around the world, and they never went to any med school. Well, a few of them did. So he decided to go with the surgery, and they removed his prostate last week. Oh, that'll be fun. And he's got to put a clip on his little weenie because now they lost the sphincter there. Oh, no, it's not fun when they remove the prostate because there's a sphincter there that holds urine. And now there's no sphincter anymore. So you got to put a clip over your peni to hold the urine in until you can train your bladder sphincter to work differently. Oh, no. No. Removal isn't always the answer. But he still has the problem. He's only removed the effect. Those tissues that make up his prostate were only the effect, not the cause of the problem. They were the effect. So he removed the effect but didn't cure the cause. So he still has the cause in him. And that's whichever side that prostate was involved in, that whole side of his body is now up for grabs. Didn't do anything for him. Compromise, more things. But they also removed part of the urethra and 2 lymph nodes. Yeah, oh yeah. It all gets pretty gnarly. All I could say to him was that now he will be sure to have to do the detox and the parasite cleanse and the GI tract, etc., that I told him to do before. Oh yeah, he hasn't done anything but compromise his body even more. Yeah, sad stuff. But people don't have confidence. So I hope this video comes out good for you guys. I'm going to do my best on it to really get in quick chemistry, quick physics, quick physiology of the body and overview that with the species and everything else, because you can't argue the point. None of them you can argue. It's all science. It's just you have to change your conditioned thinking, like his mother. To change her conditioned thinking. Now she's watching her son or whoever this is go through, the mom's going to have to watch her son go through Hellville. And then, of course, the mom is going to have problems too, because the nephew came out of the mom, or her son came out of her. In order to keep the cancer from coming back. Well, cancer's not like a being that you can cut out or that you can scare away or you can burn it away with chemotherapy. It's not a being like that can sneak back in you. No. His sewer system is down, period, already down. When you see what they call metastasize, it's just the sewer system in other places biting on them. Because when your sewer system's down, it's down on one side of the body. If your kidneys are not filtering, your right kidney's not filtering, head to toe, right side. Just wherever's genetically weak or involved, that's where you're going to see the next involvement. Yeah, it's a big lack of understanding. You guys know a lot, and I'm proud of all of you for listening to these videos and learning the truth, because this stuff is just happening everywhere, all over the place. And then when this young man wakes up to the reality of it, my take and suggestions for him before the surgery were the Fab4, the detox protocol, the parasite protocol. I would also suggest the gut, kidney, liver, bladder, parathyroid, pancreas, gastrointestinal, blood, and anything else that you might suggest. Absolutely. Plus, what's the number one? What's the number one thing you do for your lymphatic system? What's the number one thing you do when you get in trouble? The botanicals are magic healers, no question. But what's the number one thing you have to do? Change your diet. You've got to get on an extreme hydrating diet. And in the last video, I went a little bit involved with why the fruit, the ease of digestion, the loss of energy and stuff like that, because some people just have no energy. And if you have no energy, why would you eat foods that actually require more energy to break them down than they give you back? You can't keep working in the minus on energy and expect to have more energy. You can't expect protein to give you energy, because proteins are stimulants and on the acid side of chemistry. It's carbon that gives you energy, it's sugar that gives you energy, and fructose is the highest electrical sugar out there. Simple sugar. Not fructose corn syrup crap. These are people that don't have a mind that can't decipher the difference between a raw piece of fruit and manufactured sugars, I guess. His past vices include marijuana, opioids, psychedelic drugs. Oh, he likes to cruise, don't he? And said everything else except heroin. Well, that's enough. Again, these souls probably don't want to be here. Sometimes these souls, believe it or not, are more advanced souls that can't find their way. So they try to lose themselves within the altered states of consciousness way. And the problem is you are always you. You can't run from yourself, even on a trip, on opioids, any of that. You've got to face the you in you. But the guy just needs to learn how to turn this into a spiritual journey. He's obviously looking for that with all these marijuana, psychedelic drugs, things like this. It all shows up in his eye pics. Ooh. He says it's been years since he has done all these drugs. Supposedly gave them up when he was in his 30s. Okay. He is heavy into protein drinks. Oh, Lord. If he was heavy into grape juice, he might have had a chance. But heavy into protein shakes, no chance. You can't come out of this. I don't care what herbs you take. If you're pumping high proteins, take all the herbs you want. Doesn't hurt my feelings. Good luck. Don't blame me or my herbal formulas, because they're trying to work when everything is going in that's acidic. No. He eats more veggies and fruits, which I told him would have to change. He eats little meat, mostly chicken. Still, he does protein shakes, nasty protein shakes, extremely lymphatic agglomerating protein shakes, and he's got a glomulated lymph system. And just started taking mushroom supplements. Which kind? He doesn't drink or smoke. I'm sure they're not the psychedelic kind. But again, same thing with mushrooms. My cellular botanical immune formula is nothing but mushrooms, and the baby mushrooms, shiitake, all of them. I can't tell you it's going to open up a glomulated lymphatic system because I'd be lying to you. And then I've always questioned myself, how does mushrooms enhance the immune system? T's, B's. Your immune system is your lymphatic system. How does it enhance that system? Lipid-based system. Does it enhance immune cells? I've never seen any research to show the enhancement of NKs and T's and B's. He also had all the COVID shots. Man, is his mom a dum-dum. I mean, this guy compromised his life tremendously now. This is sick stuff, to include the boosters. I am surprised his heart seems to be strong. Yeah, but blood clots, I mean, I'm going to have to make this last one end. Also, he said he is doing a lot of his own research. I don't know what painkillers they have him on, but guess one is fentanyl, probably. Medical loves fentanyl. Isn't that funny? Is being used a lot in all. Yeah, it is. I'm familiar. He lives in California. Well, that says it right there. Mr. Newsom State. He has all the information for purchasing your herbal products. I am your biggest fan. Thank you, my friend. I love you. You know what? You're a good man. Protect yourself. Always take care of yourself. And all you can do is be a light to other people. This kid's going down the wrong pathway, going down the rabbit hole real fast, and Mama's probably helping shove him down the hole. And you can't do much about it. You know, they have to, and sometimes the fall is pretty far, and they can't get back out of it. So you keep up doing and keep up being the Johnny Appleseed, trying to help as best you can, and and just may the blessings be. Maybe he'll wake up, and let him watch this video. Wake up, son, and start changing your ways, because you can't treat these kind of problems. You have a whole system down in your body called the lymphatic system. And there's nothing that you can take, even herbal-wise, that magically opens that up. Look at all you guys working on kidney filtration. Some of you took months to get kidney filtration. That's a very serious thing. Allopathy thinks if you filter in the kidneys, you got an infection, you need to go on vancomycin. Killed one of my patients doing that. Thought he had a severe infection because he was filtering, ran him to ICU, gave him vancomycin, he died within the hour. His wife called me crying, but she already informed me that he was headed that way, and that she said to me, they're going to kill him. They're going to kill my husband. I know they are. And the next call I got was they killed him. Boy, I started crying like crazy. Oh, crap. That's why I have such a disdain for medical people. Ignorance sometimes is not bliss. It can be hell for the patients. Sad stuff. Anyway, I would like to know if I am on the right track with him. Absolutely. But he needs to go live on, right at this point, I'd be living on grapes, grape juice, all fruits, berries, and melons. Period. Forget the vegetables. If you have to, do a salad every once in a while. But when you get in trouble like this and you had allopathy start messing with you, you got to start healing rapidly, because he's going to get scar tissue around the urethra and everything else, and then that's not going to be fun. No. I am now 89 years old. Damn, man. That's fantastic. and never expected to still be counseling people. Well, you're at a very low-level consciousness planet, my friend, and you're one of the higher beings, and that's what we do, until it's our time to shuck out of here. But family is important, I know. I don't know if you remember me as being one of your first students way back in the days. Oh, my God, man. I have been helping many folks regain their health through what I've learned from you. He lives in California, and I still live here in Punta Gorda. Oh, man, come in and say hi. I'll give you a big hug, man. Thanks for when you can get to my letter for any advice you can add. And ILSE. Ow. Good man, love you, man. I've got to run because we've got, like I said, a podcast coming in from Australia. And I got to get myself prepared. I go to the bathroom. I love you guys. And you can just give love out, information out. That's why I'm going to try to do this video as simple and as concise as possible. And you can't go back on. There's nothing to go back on. It's part of what's coming out in these books. And it's all science. You can't deny it. If you are, you're dumb. Love you guys.